Hey, today we're going to be covering one of the most essential things in a lot of our clients that are looking at Medicare Advantage plans and the options for Medicare Advantage plans, and that's really understanding and deciphering the difference between an HMO Medicare Advantage plan or a PPO Medicare Advantage plan. What is really the best option for you? Stick around, we'll be back in a second and go over those options and make sure you understand and have some clarity on which direction you need to take. Hey guys, so we're going to dive into really the keys to understand exactly which Medicare Advantage plan is best for you, whether it be an HMO or a PPO. Those are the two most common nationally known plans. Now there are what they call fee for service plans, PFFS. There are also Medicare Savings accounts, MSA accounts. There's traditionally not very many of those accounts or those types of plans available. Typically in most markets you're going to see that the HMO plans and PPOs or an HMO with a point of service benefit, which works kind of like a hybrid Medicare Advantage PPO plan. But I'm going to cover the basic HMO plan for you today, the basic PPO plan, and then in following videos you'll see me break down and kind of decipher other types of Medicare Advantage plans that are available in maybe your market that you want to get education on, follow along so we can educate you on those. So to really decipher between the HMO and the PPO, one of the big reminders that I like to remind people on when it comes to an HMO is that remember that the HMO is a network-driven plan that typically is secluded to a regional or a state location. So we live in the state of Tennessee, right outside of Nashville, Tennessee. And so here an HMO plan typically will be networked with primary care doctors, specialists, and hospitals in this area. And if you go outside of the area of Tennessee or the region of Middle Tennessee, you may be out of network. And what that means is you would not have access to care to a regular primary care doctor that you'd like to see, or a specialist that you would like to see, or a hospital to have a surgery or a procedure. Now understand, anywhere that you travel with an HMO and or a PPO plan, you're going to have access to care when it comes to urgent care needs or emergency. So if you're traveling and you're in California visiting family in San Diego and you're there on Coronado Island, and all of a sudden you fall down a flight of stairs and you bang up your knee and you need to go to the ER to have some sutures to tie up maybe a situation with your knee, you can actually go to the closest emergency room, have access to care, and on an HMO or PPO plan, you're going to pay a copay amount and be able to access care. Also, if let's say you're visiting family over the holidays and you're there for a couple of weeks and you get a sinus infection and it's a weekend or a weekday and you're trying to access care to get maybe a Z-Pak prescribed for your sinus infection. If you're here in the South, most of us have had some form of sinus infection, and a lot of times a Z-Pak is a solution for that. So there you can walk into an urgent care, or what's called as a walk-in clinic, and have access to care there or here locally as well. So emergency is life-threatening. Urgent care would be non-life-threatening. Obviously, if you fall down a flight of stairs, you get a concussion, bang your knee, it's going to have sutures, or maybe broke a hip, I would encourage you to go to the emergency room. If it's a sinus infection or a mild cold, maybe the flu, I would encourage you to go to the urgent care, but that would be access to care anywhere that you go. So the HMO network is typically driven to a regionally based area or a state-based area. Outside of that network, typically you're going to have the inability to use your plan. Now, there are Medicare Advantage carriers that have HMO networks that are called national networks. That means you could be in Tennessee and you could go to a reciprocating state like Florida. United Healthcare has got plans like this where they have national networks. And that means if you go there and you look up HMO network doctors, primary care specialists, and hospitals, you can actually go there and be able to go to get care there from a primary care doctor, specialist, or hospital. So you need to be very specific when you're sitting down talking to a licensed agent or agency like we are, and walking you through and providing you guidance when it comes to an HMO. Now, what I like to often say is the out-of-network situation is you want to be very clear if you're going to be traveling, if you're going to be living somewhere for a couple months, maybe a snowbirding situation where you're in Florida for a couple of months and you want to have access to care to other doctors outside of your immediate residential area that you live in, you want to make sure that HMO will provide adequate coverage. Then also realize in an HMO Medicare Advantage plan, typically they're going to be zero premium, very low premium, if they have any premium at all. Normally in most markets, especially a metro area like Nashville, Tennessee or Middle Tennessee, HMO plans typically have zero or lower copay costs to access care when it comes to primary care and specialists. They typically have lower costs when it comes to diagnostics and surgery, outpatient surgeries. Even going into the hospital, the administrative costs for copays when you get admitted to the hospital, the copay cost per day for hospitalization typically is going to be less on an HMO than a PPO plan. Not always, but normally I like to tell my clients, if you're looking at a Medicare Advantage plan, let's look at the options first based on your network of doctors, specialists, and medication. And a lot of times we use a software platform and it pulls up, and usually the HMO plans are going to be ranked top of list of options to be the lowest cost plans. Now, let's go over, the PPO scenario. If you're looking at Medicare Advantage plans that are PPO, historically, we a lot of times will talk to people and they'll tell us, well, I had an agent tell me that if I have a PPO plan, I can go to any doctor, any specialist, any hospital, anywhere, anytime I want. And that's really not really providing you the correct information when it comes to how a PPO plan really works when it's a Medicare Advantage plan. Yes, a PPO plan has an in-network, meaning like a regional or statewide or in-network area that plan covers. It has an out-of-network option. So the out-of-network option really works like this. The doctor, specialist, or hospital has to agree to accept the plan and build a plan for your services. So if you go out-of-network and you want to go to a specialist and you live in Tennessee, let's say you live in the southern part of Tennessee and you want to cross over and go to Atlanta, Georgia to see a specialist. You have a friend there, they had a knee surgery, the specialist did an extremely good job, and you want to go to the same specialist, the orthopedic surgeon that did their surgery. If you need to make sure that you call and communicate that you are on ABC Medicare Advantage plan that's a PPO and ask if they will accept that as an out-of-network plan. Make sure they're willing to build a plan and take that plan, because if you were just to show up for a doctor's appointment and just go down there to do a basic review of your situation with the specialist and whip out your PPO card, it's very likely that they may just say, hey, you're out of network, we're not willing to accept the terms and conditions of the plan to bill that carrier for your PPO plan. So that eliminates really the thought and mindset. A lot of people think that if they're on a PPO plan, they can just go to anybody they want to. That's just not how a PPO plan works with Medicare Advantage. Also, remember, if you visit out of network hospitals, providers, or services, you can be turned down. Regardless of the PPO plan, you can be turned down for service when it comes to that plan. That means 100% of that cost would be your responsibility. So if you still are a stubborn person and say, I'm going to go to the doctor anyway, that's fine. You're going to be taking on the responsibility of paying 100% of that cost because they're not going to build a plan. Also realize that with a PPO plan, if you go out of network, you're typically going to pay 30, 40, 50% cost on the billable of that visit or surgery or whatever you're having done out of network. And also the out-of-pocket max, the MOOP, what they call MOOP, max out-of-pocket max, for that Medicare Advantage plan. Typically in an HMO plan, we see most of those plans are anywhere from about $3,000 to $5,000 or $6,000. With a PPO plan, a lot of times they're anywhere from about $4,000 to $8,000 or $7,500, a little less than $8,000 for the max CMS allocated max out of pocket right now. You'll typically see a PPO plan is going to have a max out of pocket that's going to be a little bit higher than most HMOs in your area. But if you go out of network, they're going to have a network out of network max as well, which typically can range anywhere from about $8,000 to $12,000 in cost. So you just need to be aware that when you're looking at choosing a Medicare Advantage plan, whether it be an HMO or a PPO, I typically like to start with HMOs. If somebody's going to be in the area and not going to be traveling all the time, they're going to be going on vacations, but they still have access to care for emergency or urgent care. HMOs in our market typically work best. They have lower costs, more benefits. The costs overall for medications on the formularies are good. But in other states and other areas, sometimes a PPO plan can be a better option. And we do have situations where people want a PPO plan just based on They don't care about the cost as much as the access of care. They just want the mindset. They have the mindset that the PPO is the better option for them. So in that situation, we typically just guide towards the PPO that's still going to cover their primary care doctor, the specialist that they're seeing at the time, any hospitals that they're interested in making sure they're covered, and making sure their medication is covered properly. Guys, if you have additional questions, reach out to us anytime. We'd love to be able to answer any questions that you have. Also, if you have not liked and subscribed to our channel, please do, and we'll talk to you on the next video.